what are we going to talk about today? As usual, I'm starting the webinar with just a few terms that are relevant to today's conversation. So we're here, generally speaking, because we're all excited about data and how data ties into the functions we're trying to carry out on behalf of our governments. So why does data matter? It helps us understand and work towards the outcomes that we desire, right? It helps us identify what it is that we're trying to run after, create targets, inform planning, and design initiatives and interventions that help improve and work towards those outcomes. It helps us talk to our citizens about progress we're making, challenges we're having, things we need their help on, helps us understand and celebrate progress and success that we're having in our programs, our services, anything else that is of relevance to us. And it helps us apply new learning. So that's why we're all here. When we're talking data, data is everywhere around us. It's everything. It's numbers or it's observations that we collect and look at that help us make good decisions. And this is a basic function of the governments that you're all a part of. Today, we're going to be talking a little bit more. We're digging into indicators today. So we'll use the term benchmark or baseline. That's referring to a starting point. That doesn't need to be a starting point of an initiative, but that's the starting point of the data that we have. And from that starting point, we can understand the progress that we're making relative to that number or that observation. A target is then what we're trying to reach. So what is the number or the indicator we're looking to try to meet through our activity, and how much progress are we making towards that target? The outcome, I've already probably said that like 8 times. Measurable statements that let us know when we've reached the goal or reached the target. And an indicator is a piece of that helps us know how far we are in meeting that desired outcome. So we've included this little graphic on each one of the slides for each webinar so far. So an example, Indigenous children are connected to their culture and community. That is an outcome that matters to this particular government. And so they are tracking the number of individuals with secure access to traditional language lessons. And they are tracking the number of children in care that have been reconnected back to the culture. So outcome indicator. And then socioeconomic gaps. So that's also what we are interested in, is for the measures that we are tracking, the indicators that we're tracking, that is also tracked for other citizens, Canadian citizens more generally speaking. That's usually the comparison we're looking at, and that is where there's a disparity between what others have attained and what we are attaining. And that's the gap that we look to close, the disparity that we look to close. So for example, I've used this example before. In BC, we know that life expectancy for Indigenous peoples is 9 years less than the general population for British Columbia. So that would be an example of where we can use that data to call attention to different policy interventions, funding that's needed to address that inequity. Next slide. So that kind of sets us up for today's conversation. So I'm really happy to have Doreen McNeil with me today. Doreen works at CIHI. She's the manager of performance improvement and capacity building. She doesn't want a big long introduction because she's a very humble person. She's probably totally uncomfortable even at this moment with me talking about her. She's got her colleague Rena with her. Her and her team have gone, I would say, over and above in terms of working with us to prepare some really interesting content for today's webinar. Very, very thoughtful. So I want to welcome Doreen and publicly thank her for all of the good work that that her and her team have done to partner with us on today's webinar. So next slide. What are we going to do between us today? We're going to hear a little bit more about CIHI. So that's where Doreen works. They're also a client of mine and a group that I partner with. So we'll get a bit of an overview of who they are. We're going to talk about the learning objectives for today's webinar. We're going to go through, again, why measurement matters and why it's important, kind of from an indicator perspective. We'll talk about indicators. We're going to take a bit of a break. Then we'll come back. We'll go through an indicator life cycle briefly, and then we're going to spend a good chunk of time on a very interactive case study. And then there are opportunities for interaction throughout. So you'll see on the slides where we're calling out and inviting your participation on specific questions that we'll be posing. So even though we'll have a Q&A at the end, we just encourage you to kind of keep that flowing throughout the webinar today. Next slide. And I think this is over to you, Doreen.
It is, thank you. I also have two monitors, so I'm not looking off into the distance, but just trying to manage all the information that I have. So good afternoon to all of you. I'm speaking to you today from my home in Dartmouth, Nova Scotia, located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. It is a pleasure to be here with you today and to participate in one of these sessions. As I continue my own cultural humility journey, sort of ongoing learning, being part of this session and certainly having the opportunity to work with Harmony on developing the materials for today are really incredible and valuable learning experiences for me too. So many thanks for including me and for welcoming me. So as Harmony mentioned in her introduction, my role at CIHI is really to support the use and understanding of data. And in this role, I've had the opportunity to work with folks from across the country who really want to use data better in whatever role they might have in their governments or their province or their territories. And today I'll be talking to you about using and selecting high quality indicators, but I do not have the context or understand the uniqueness of each of your own individual governments or communities. But as Harmony mentioned, we're really hoping that people will jump in and share those perspectives and experiences and ask lots of questions. Typically, these sessions, the greatest learning actually happens between the participants rather than anything that I could share with any of you. So really encourage lots of discussion today. So with that, I'll give you a little bit of introduction about who CIHI is. So CIHI is not a government organization, but a not-for-profit. It was established over 25 years ago in sort of the response to address the inadequate state of health data in Canada. Right now, there are over 700 employees. We have 4 offices, but there's also a few of us who have worked from home in sort of like remote work situations. So I've actually worked from my home for over 10 years, so way before COVID. But even though I worked from home, I'm also not very tech savvy, but I think Harmony and Allison and the team will help me with that. So CIHI's focus is really about the management and use of health system and population health data. And we as an organization are focused on providing meaningful and actionable, and most importantly, high quality information to be used to drive improvements in the health and the health systems. And at the forefront of our work, of course, is privacy and security, and ensuring that the integrity of the health data that we do hold. So next slide, please. Just a quick snapshot of our strategic plan, because I do really think it gives a really nice summary of the work that CIHI does. So our current strategic plan was recently extended for a year as a result of COVID. So we are in the process of doing extensive consultations across the country to inform our next one. But you'll see the strategic goals in the middle of this slide there. So data standards, analytical tools, useful analysis. Those are really CIHI's core offerings and business areas. Under populations, you'll see First Nation, Inuit, and Métis. And that was included based on direction from our stakeholders in the development of that last strategic plan. Although we don't really think that that work necessarily fits under populations anymore, having First Nation, Inuit, and Métis identified as a priority population really set into motion a lot of the resource and effort to build up our Indigenous health program of work over the last 6 years. So next slide, please. And you can see here the range and types of mostly administrative data that CIHI manages. So hospital data is probably our biggest piece, but the data does cut across healthcare sectors. And we do have information on things like spending and workforce and home and long-term care and those types of things. We do collect information from a few First Nation, Inuit, and Métis organizations, including long-term care and hospitals that are on reserve. And generally it's in situations where it's quite integrated into the provincial systems. And while we do collect this data, importantly, we do not report this data. So in recent years, we've taken a really deep look at the processes and policies and have made changes to ensure that what we call Indigenous identifiable data will be released without approval from the appropriate Indigenous authorities. So this applies to everything. So all data requests, data analysis that we might do, reports, and even activities like this, like our capacity building work. And it refers to Indigenous people, communities, and organizations. So next slide. So over the last number of years, CIHI has focused on its Indigenous health program of work. And in working with First Nation, Métis, and Inuit organizations, some key messages have come up consistently and again and again. And we've tried to crystallize what we've learned to some principles that guide all of our work. Of course, it starts with respect for self-determination, but in the case of a data organization like ours, the principles of OCAP and Indigenous data sovereignty are key for us. We have heard that it's also important to take that distinctions-based approach and to make sure that we recognize and respect the diversity of needs and interests. Cultural safety and humility are critical. And obviously in the context of healthcare delivery, they are, but also in the respect of the work that we do with health data. And CIHI as an organization has really made a commitment to cultural and safety and humility at sort of the leadership level, but even with the employees within CIHI. We recognize the role is one of support to Indigenous-led processes and priorities. So while we may be able to contribute, again, we only do so through partnerships and is guided by First Nation, Inuit, and Métis partners. That has sort of guided CIHI's Indigenous health strategy. And I'll actually pass it over to Harmony, who will talk a little bit about this.
Next slide, please. So what you should be getting from this slide here, as well as Doreen's comments, is that, CIHI has done more than other organizations in terms of being thoughtful about Indigenous data sovereignty and Indigenous data governance, and tried to build that in not just to kind of direct partnership conversations, but through all of the policy work in the organization. And so I thought it was important to reflect on that, because we were thoughtful about who to bring in to this circle with all of you to be talking about these issues. And so in my experience working with a lot of national and regional data organizations, without question, CIHI has done more in terms of data sovereignty. So just wanted to set that context for today. CIHI's work in this regard is crystallizing into this Indigenous health strategy. And as I said, I've provided some advisory support to CIHI on this and done some interviewing with Indigenous organizations across the country about these pillars of the strategy. So the first is foundational capacity. So CIHI doing its own internal work to educate itself, as Doreen spoke to. There's this kind of strong commitment to understand the history of Indigenous peoples in Canada, how that ties to CIHI's mandate today, and do appropriate training, education, awareness raising, continued opportunities for learning, so that CIHI can prepare itself to be a good partner in this space with Indigenous people. Second, I'm going to go down. So Indigenous governance of Indigenous data. So as noted, they've done kind of quite significant policy reviews to ensure that the way that CIHI does its work and carries out its mandate is aligned with Indigenous data governance principles and the fact that that data is owned by Indigenous peoples. So that's kind of its work that it can do itself as an institution to be a good partner. That prepares CIHI to undertake relationships and partnerships with First Nations, Inuit, and Métis organizations in pursuit of their health and wellness priorities. So, where there's an organization that's like, you know what, like we need some help in conducting analysis of this data, or we need help storing this data we have. Like, can you help us with that? Because that, the Indigenous partner understands what it is they're trying to achieve. They own the data, they have rights to it. CIHI brings a different set of tools and resources to the table that together then can advance shared priorities as well as the interests of the Indigenous partner. And then analysis and capacity building. So similarly, where there's kind of specific efforts that CIHI can make to support Indigenous partners on using their data and building their capacity to analyze that data. CIHI is embarking on that kind of work. So again, just wanted to touch on this because I see, as someone who's working with both the Indigenous governments and CIHI, that there may be some opportunities here for a fruitful partnership, whether that's at that individual IG level or collectively amongst the self-governing Indigenous governments beyond this webinar. So yeah, that's kind of the overview of CIHI and the work they do. And I think if we can go to the next slide, we're going to talk through today. We're going to start digging into the indicator topic of this webinar. So what should you be able to do after the session today, or what are we going to try to impart to you? One is, how do indicators tie into decision making? So, the relationship of those indicators to strategy, vision, planning, decision making, and what's the relationship between indicators and good decision making? We are also going to look at how do you work with indicators? How do we think about this within an overall life cycle model to select indicators, to select appropriate benchmarks, to set appropriate targets, and then monitor results? So that's really the flow of what we're trying to get through today. Next slide. And I think I'm back over to you, Tori.
Yeah. Okay, so let's start off. Oh, if we could just, actually, no, just leave it here. That's fine. Okay, so we're going to start off generally and discuss why we measure things and what is the value it can bring to individuals in different roles. So I like to say to think of measurement as a tool. It is a resource in your toolkit that can help you with quantifying information and finding evidence. So first, measurement can help to identify the area of need. So in situations where there are multiple competing priorities, which I'm sure for most of you on the call, that is all of the time, measurement allows for identifying where a need for improvement or change is critical. So quantifying a need and defining those priority areas and pinpointing areas of focus. And again, with thinking about measurement as being a tool, it is a tool for communicating information. So communicating information that change has happened, or the level of success that has been achieved, or amount of progress toward goal. And finally, one thing that we will touch on quite a bit today is the idea that measurement helps create and build alignment within a government or an organization. And measurement can be a tool to get everyone working towards a common goal. So with the idea that everyone is measuring something relevant to their work that is also tied to the overall goal, it's also the idea that different people and different roles require different pieces of information. So that alignment piece is something we'll touch on quite a bit today. Next slide. So measurement tool is, of course, indicators. So indicators are measures designed to summarize information about a given priority topic or about a population or a system. And indicators provide comparable and actionable information across different locations or organizations, and also track progress over time. Indicators are one small piece of a big picture. I like to say that indicators can act as flags. So they're letting you know where things are going well, where you might want to pay attention. But there's a lot of other things that need to be considered, contexts need to be considered when you're thinking about your indicator results. So we'll talk a lot about that today as well. Throughout my portion of the presentation today, I'm going to speak largely from the health system perspective and use health examples because that's something I'm most comfortable with. But everything we talk about in terms of how to use data and indicators can really apply to any sector and certainly within a whole community or government. Next slide, please. So I'd like to give a bit deeper into indicators to talk specifically about how indicators can be used. And you thinking about how they may be relevant to you or useful to you in your roles. To do things, I'm really thinking about good, high quality indicators. And we will talk in just a bit about selecting high quality indicators. So first of all, high quality indicators can reliably measure progress or success, and they can measure it over time or across and between areas within your government or groups of people. And they can do this because good indicators are ensuring that you're measuring the same thing over time or in different locations. They can also help with setting goals and objectives and identifying and communicating what success might look like. Again, that's because they're consistently measuring the same thing, so you can reliably quantify the change that you're seeing. Reliable and high quality indicators also provide reliable and high quality evidence. Evidence to make decisions and evidence to inform what priorities should be. Another topic that we'll cover today is what I like to call digging into indicator results. So doing a deep dive into indicator results to explore potential drivers or factors contributing to indicator results can provide valuable insights in terms of potential underlying challenges or provide ideas of why something was successful, why a change was successful, and to learn from that success. And again, so importantly, good indicators are good tools. They can support communication and provide a tool for accountability. So if an organization makes a commitment to change, an indicator is a great tool to sort of hold themselves accountable to that improvement or change. Next slide. So just to build on that, indicators can provide information to a lot of different groups on a lot of different topics. So the types of indicators, types of information that indicators can provide may be related to, how happy and healthy is our community? Do our people have access to what they need in terms of services and resources? And is that access timely and equitable? Are there disparities or groups at risk or pockets of success? Where are we having an impact and where are we not? And are we getting better? So those are just some things to think about, like how broadly indicators can actually be used and applied. Next slide. So now that I've talked about all the wonderful things a good and high quality indicator can do, let's talk a bit now about what makes an indicator and some things that you yourself can think about when you're thinking about identifying an indicator to meet your information need. So the next slide. I think Harmony might jump in here too. I know she has lots of thoughts on good indicator, bad indicator. So just here you'll see some criteria of what, what I think of makes a good indicator. So the thing that I think is most important is really that relevance piece. Considering whether or not an indicator is relevant to your government is really the foundation of creating a program of performance measurement that is going to be informative and valuable and also not overwhelming. So sticking to indicators that are telling you something about areas that are priorities to you and your communities will ensure that you can focus your efforts on indicators that are telling you the most meaningful information. Always keeping in mind that More indicators means more measuring and monitoring and more people and more resources. And some of you may have heard the term indicator chaos, right? So always keeping in mind, is it closely tied to the goals and priorities of my government? Is it providing information on a topic that is meaningful, important to my community? The next is measurable. So again, thinking about using an indicator, you are typically using it because you want to measure and monitor something consistently to track performance or success over time and potentially to make comparisons. So consider what aspects of that topic are of interest and can actually be measured. So in this case, I always like to use the example of wait time. So waiting for access to a service, waiting for healthcare. And wait times are often used because, one, they can consistently be measured. There's a start time and there's an end time, and it gives you a sense of access to whatever service is being measured. And oftentimes, sort of wrapped into that idea of measurable is feasibility. So oftentimes wait times are already being tracked anyway, doesn't really add a necessarily additional time or resources. And also thinking related to that is that timeliness piece of, if there's everybody who goes in potentially has a wait time. So there's a lot of data and potentially a lot of data that you can get relatively quickly. Valid. So in a little bit, Harmony will touch on sources of indicators and data. And when you're thinking about what indicators to use, I encourage you to think about what already exists or what others have used and have had success with that may be relevant to your context. And explore what others have used to measure a similar concept or topic. Actionable, again, tied to that idea and concept of alignment, and that will continue to loop back to throughout this presentation. The indicator you select to measure different aspects of a goal should provide information that is actionable and usable by those who are responsible for measuring that information and doing something with it. So actionable is really specific to the perspective you have and the role that you play. Because something is not actionable for one group, it may very well be very meaningful and actionable to another. Speaking of actionable and sort of that idea of different types of indicators for different information needs, just to pull in another example that I often use is, a lot of programs and certainly with healthcare, there's a lot of surveying now of experience or satisfaction. So, and oftentimes there's a question related to, how would you rate your overall care experience, for example? That overall measure, might be really informative, again, acting as a flag that, a lot of people coming into this program rate it really highly. But if someone responsible for that quality improvement of the program or ensuring that people are really happy with the program, you might be really interested in, their responses to questions of communication and was it respectful and engaging and were you involved in decision making? So thinking about that specificity, you also see as a factor listed on the slide here. That specificity is really tied to the actionability too. So Harmony, did you want to jump in here with some of your examples?
Well, I think what you said at the beginning of this slide is really, it's part of what is exciting about the work that this group is doing, which is, I think for many, many years, those of us that have worked in different roles in our governments and local administrations, are been forced to prepare reports and report against indicators that really matter to somebody else, but don't matter to us. So how many workshops were held, or, how many people attended the open house at a community meeting? That doesn't really necessarily matter to the government itself, to the Indigenous government. So that relevance aspect is, I'm just glad that you articulated that as the foundation, because for me, that is the most exciting part of some of this work. I think often I found, so when I was running performance measurement for a large organization, um, we would get ideas all the time about things like, can we measure things like, or the performance indicator should be increase the quality of our services or increase our client knowledge about health and wellness. And like, those are things we want to achieve as goals, but they're not like, I was like, how do I measure that? Like, I couldn't measure that as an overall concept, or in order to do that, I would need a whole bunch of kind of sub indicators that would tell me whether we are making progress against that goal, because it wasn't really measurable. Increased quality or increased knowledge, it's not measurable, it's not specific. There's no consistent way to measure that over time. And I wasn't really sure what we were going to do with that information. So like, we would drill in and, force people to get into the nitty gritty of like, are we talking about the number of client visits to a certain program over a certain period of time? Or as you described, like, what are clients reporting as the most positive aspect of their experience with the program, as opposed to just, are they happy or not on a scale of 1 to 5? So in terms of things like increased knowledge, like, I would get this one a lot too. We want our staff to be knowledgeable about our organizational policies. And it's like, we have so many policies. There is no way that it's reasonable to expect that people are even going to know how to respond to that question. So we would dig into things like, well, what's the most important policy that we have that people need to be compliant with? And it was often about protection of personal information, which we've talked about a little bit in this series. So then it was like, okay, let's dig into the percentage of staff that have been trained in privacy, in their privacy obligations under the policy, and how many of them are reporting a change in their practice as a result of the training we're giving. So those were more kind of specific examples. The other one that, like, I mean, it's a dated example now, but communication with citizens is often very, very important. How do we communicate with our people? How do we make sure that they're getting the information that the government is issuing to them? So at the time, it was like door-to-door flyers was the way in which we used to communicate. This is like before Facebook and stuff. And so it was like, oh, how many flyers did we print off? That's going to be the goal. But then we would just find all the flyers in the garbage, like at the bottom of the hill. So it wasn't about how many flyers we're printing. It was about how many flyers are delivered, door to door as a result of the communication effort. So just a few examples, things that came to mind to me when I was thinking about my past experience in this area.
I love those examples. Really focused on like the result and outcome rather than how we did something.
Right.
Yeah. Do you have any other questions or comments on this before I move on?
Folks are just invited to keep throwing stuff in the chat. Let us know any examples from your experience. This is all helpful, not just for us, but for each other as well.
Okay, so we can go to the next slide. So that last piece of actionability that I touched on there, and the fact that indicators and good indicators are really dependent on your role and your perspective. I'd like to jump now into sort of meeting the needs of different individuals and the idea that different information needs and different perspectives will require different types of indicators. Next slide, please. So when you're first thinking about selecting indicators or thinking about an information need, often a really good place to start, think about who has a role to play on this topic and who might be interested in having more information on it. And typically this extends quite broadly and may include the community, other sectors of government, organizations, or individuals that are providing services in the community, such as educators, healthcare providers. So the example that you see on the screen here is strictly from my perspective and some of the work that I've been involved with, and some of the different groups and organizations that are often relevant to some of the work that I have seen, and that folks have reached out to get more information on a particular topic. But when you think about your own roles and thinking about information needs that you might come across where you need to get more information about the topic, are there any thoughts on others that you might reach out to, or where you might start in gathering more information about a topic? So feel free to throw it in the chat or raise your hand. And Harmony, you might have thoughts on this one too.
Yeah, like I think about, at a government level, like who are you kind of touching the most, and who might you have a need to talk with about shared interests or goals is kind of what came to mind. And, so things like local school district might be one where you want to know as a government, how are your kids doing and performing within the local schools? And they would be interested also in that same goal. So that was one that came to mind for me. Or even as a group together as these self-governing Indigenous governments, that there's things that you may want to collaborate on together and are collaborating on together. And those would be very different, I think, indicators and data needs as a group of self-governing Indigenous governments, maybe relative to the things that any individual government might need to do with its local school district or regional district or other, if there's a municipal government nearby. Those were some of the examples that came to mind for me.
Yeah. And I think, just even thinking about this early on will set you up for success, because as you'll see as you do the life cycle, that it really is a process and an ongoing process. So that early engagement it can be really valuable. Mm-hmm. So if we go to the next indicator, so we can take a little bit of an example of how different individuals within a system typically, monitoring very different indicators, but the indicators are all tied to that overall goal. And each of the different indicators is providing information that is relevant for that group and reflects the role and the contribution that they make in working towards that goal. So what we have on the screen here, maybe a oversimplified example. I've seen it where, this idea of alignment might have 3, might have 16 levels or people who are interested or have different information needs. So here we took the example of improving access to programs and services. And Harmony, did you want to walk through this example?
Sure. So I was thinking about what might be an example that the self-governing Indigenous governments might actually be kind of real. So, if an Indigenous government, for example, had a goal in their strategic plan to improve access to programs and services, and remember, that is a goal, that itself is not an indicator. So if they set that as the goal in their plan, then the question would be, what are the indicators that would tell us whether we're achieving that goal? But it's not just one indicator for everyone. Everyone may have an interest in one, but based on our unique roles within the system, we might need more detail or a different kind of information that tells us how we can exercise our particular decision making. So if we thought, in this case, I was thinking about, let's say, a Head Start program, and maybe that would be a priority for increasing access to Head Start. Maybe the community, to report to, say, someone like me who's just, citizen of the government, I want to understand whether there's universal access to that Head Start program. And that might be the thing that we want to know is, have we provided universal access for all of our kids to Head Start? That's a really simple, it's aspirational, it's something people can understand and get excited about. Whereas if I'm an elected official within that government, I would need to know, what's the wait time for that program? If we've said, and we're trying to increase access, but we have 28 people on the waiting list, as an elected official, that tells me, well, we might need to be making some different decisions about our budget to add more resources into the Head Start program. We might need to lease a new facility or get an expanded facility. We might need to create a plan and create funding. That would be the kind of decisions that a government official could make. And so wait time would be a very good indicator of whether they're meeting the need for improving access or not. And then if I was running the program, like if I was the administrator of the program itself, I would want to know what's the gap between kids in the community that are eligible for the program relative to those enrolled. Because then that would tell us, well, where do we need to do outreach and promotion to get more people aware of, interested, feeling safe, feeling excited about getting their kids enrolled. So that's a kind of information where we want to think about, what's our shared goal? We're all in this together, but each of us might need different information that helps us exercise our specific decision-making within our control to work towards that goal. And I think we're going to the next slide. So we also thought that it'd be worth just taking a moment to cast our minds back to the conversation we had in the last webinar about the history of data and Indigenous peoples. We talked about how, there is a history, and I talked about it a few slides ago as well, about, we get told what measures matter, and then we're all scurrying around to collect data and measure against those indicators when really maybe we're not driving those indicators ourselves. And often, in the past at least, that data has been used against us. And so there has been this significant movement towards measuring wellness or measuring strengths-based indicators that matter to us. And it's just, we can get really locked into those indicators that are told to us that's important. And so part of what's exciting about this effort is we can pick and choose which of those matter to us, but we can also design and consider our own. So there are some examples. There's like different frameworks, and we'll talk a little bit about frameworks in a bit, but it's just an opportunity for you to think about like what matters to your government and what matters to your nation based on your unique circumstances, cultural background, and set of priorities. And how are you capturing that in indicators so that we have both an opportunity to celebrate our success and our strength, as well as understand where we have need for improvement and action. So there's just a few examples on the slides of some wellness indicators. I'd invite people to kind of throw in the chat anything else. The chat is like super quiet today, so I don't know what is going on out there, but I would just say if anybody has thoughts about strengths-based indicators, this is something I'm really passionate about. So things like prenatal screening, making sure there's like access to young moms to required services to make sure that they have healthy pregnancy and that the babies born in our nations are healthy, that the percentage that have an opportunity to participate in cultural activities and services, whatever they are, it might be language. And this is where you can take a global indicator like participating in cultural activity and make it very specific to your cultural background. So is it, out on the land activities? Is it traditional food harvesting? Like whatever it is that matters to you. Percentage reporting, feeling in balance. So do people feel that they have spiritual, emotional, physical, mental wellness in balance within themselves? And the one that I care the most about is, do people feel that they have an opportunity to be self-determining, that they are in control of their lives, that they have an opportunity to make choices, and that they feel empowered to speak up about those choices. So that one is one that I think is critical and particularly interesting. Next slide. Yeah. So now we're going to kind of start to dig a little bit into how do you find data relative to those indicators. So next slide, please. So just a bit of a reminder about kind of where we've been and where we're going. So in the webinar 3, Laurel in particular dug in quite a bit into what data may be already out there in the system to meet your needs and the different processes that you might need to go through to source that data. So we talked about data governance processes, we talked about data access requests, we talked about information sharing agreements, and going through those processes with governments, with regional data stewards, whoever your provincial or territorial organization is that might house the data, for example, from the regional health survey. We talked about things like your Ministry of Health or Ministry of Education within the provincial system. Those are all sources of potential data. And again, there's a relationship between data availability and indicators where like one kind of in some ways drives the other. And where you don't have data, but you have an indicator you really want to measure, you may have to go and collect it yourself. So we're going to talk a little bit about that now, but we're also going to dig into that a little bit more in tomorrow's webinar. So next slide, and back over to you, Doreen.
Yeah, so just to build on that last point that Harmony mentioned, that is a challenge, a very common challenge that many face, particularly those who are in small communities or governments, is that there is often limited or data for an indicator that you have identified as potentially being really useful to you. So just some high level things to consider. So collaboration, obviously, I think a really obvious one, but I've been part of some really great conversations where folks had similar struggles, totally different locations and settings, but came up with some really quick creative ways of identifying new data sources or leveraging existing data. So thinking about different aspects of a topic that perhaps you never thought about measuring. So perhaps you can't measure wait time. What are some other aspects related to access that we could easily measure and that makes sense for our community? Thinking about that visual, the different information needs for the different audiences, consider information that others might have. So if it's a topic on health, for example, but there is no relevant health data, what do we have related to education that might actually form a health need? Consider your scope. So collecting and tracking indicators over an extended period of time may not necessarily be feasible in every situation. New data collection can be burdensome, but consider a pilot approach whenever there's new data collection is always sort of a safe bet. And maybe we won't collect it for a year. Maybe we'll take chunks of each year and collect data. So thinking of creative ways to still get information that again makes sense for you. So when thinking about selecting indicators and using indicators, often the most challenging piece is thinking about where do you even begin. So the idea of an indicator lifecycle approach is something that often resonates with a lot of people because it defines a clear place to start while also highlighting that making the use or the best use of indicators is really an ongoing process. So the lifecycle approach that you see here is a tool that can be used to guide the selection, or in some case, the development of meaningful and appropriate indicators, and can provide a step-by-step approach to monitoring your indicators over time. So in a few minutes, we will apply the indicator lifecycle to a case study approach, but I will just go through quickly the 4 steps that you'll see here in the visual. So the first step is identifying where there is an information need and who needs information on that topic. Step 2 is selecting the appropriate indicators to meet those information needs. Step 3 is exploring your results and doing that deep dive into your indicator results that I mentioned before to explore those potential factors that might be influencing your indicator results that you're seeing. And the 4th step is sharing and using your results. So using the indicator results as a communication tool for highlighting success or for driving further improvement. And within step 4 is also about that assessment. So making sure that your indicators are still meeting your information needs. So next slide. So one other tool that I did want to touch on before we get into the case study is frameworks. very likely that many of you have come across different frameworks in different parts of your work. There are many different types of frameworks selected, again, based on your context and the activity that you're doing. This is just one example that we have here, which is the First Nations Holistic Policy and Planning Model with the medicine wheel in the middle. So in the context of our discussion today, when thinking about the selection of indicators to inform a topic area, frameworks are a really valuable tool to help ensure that you're taking that big picture view and considering all of the different elements that are potentially at play. Because again, indicators are only that flag. A lot of other things are happening, a lot of other things potentially influencing your indicator results. So thinking frameworks in the context of selecting indicators, again, they can help you take that big picture view, and so can help identify measurement gaps and opportunities for measurement. And another really helpful feature of frameworks is that they help create sort of a common language across the different individuals who may be working as a team to identify indicators. So it goes back to that visual of all the different people or organizations that might have information need related to that indicator or topic. If you use a framework working with a group of people, you all have this defined scope. You all are using similar language to describe what you're going to gather information about. So a valuable tool in that sense. Harmony, I think you might have, I know you have lots of experience with different frameworks. Thoughts on that?
Yeah, I'll just give a quick example, and just like fair warning, this is not the best of subject matters, but I just directed a study here in BC about racism in healthcare. And in that study, what was really important to us was that we created a very clear framework around how do we talk about the issue of racism and its impacts on our health and well-being as Indigenous people. Because often things like poorer health outcomes, Indigenous people tend to be blamed for their own poor health. When really, if we create a framework and we very clearly show, here are the health outcome disparities, here's how the health system is performing for Indigenous people, and here's how that's different from non-Indigenous people, then we understand, for example, that if the health system has racism embedded within it, it does not perform as well for us. And that impacts our negative health and well-being. And if our experience is poor in the system, right, if we face discrimination in accessing services, that too has a negative impact on our health and well-being. And we also need to measure processes to know if things that we're doing, such as educating people about Indigenous health and wellness, about racism and bias, actually makes a difference. So in the case of that study and in some of the follow-up work, we're creating a framework that very clearly includes a number of interrelated big pillars, like, health system activities, the experience of healthcare, the performance of the healthcare system, and health and wellness outcomes. So in that case, we're able to see, as you noted, Doreen, kind of the big picture, instead of just picking one indicator and pretending that tells us the whole story, because it never, ever does. So frameworks help tell the whole story and get at a better sense of what the truth is.
Mm-hmm. Yeah, and that interrelation piece is so important too, because when you're thinking about improving one thing, what are the impacts over here? And similarly with selecting indicators.
Exactly.
Okay, next slide. So case study. So I believe there was a case study sent to you. It's quite short. I think it's 1 page and a little bit. Did we want to take a little bit of time now just to quickly review it, 2 or 3 minutes?
Yeah, do we have that, Allison? It's the Salingatuck government case study that is embedded within the toolkit. So we did cover this in webinar 1. We did a quick little overview. It's a fictional government.
Harmony, I'll put it in the chat for everyone.
Great. Thank you, Mika. So we'll just want to take a second to skim that when Mika's popped that into the chat. Just to orient what this fictional government is, and then we're going to go through indicator development. Oh, there it is. So are folks able to open it? If you can't, don't worry. You won't miss anything big. We'll walk you through it. Okay. Let's go to the next slide, I think.
Okay. Okay, so Salingatuck government case study. This is a fictional case study. All of the information that I am showing is fictional and have been developed to support conversation and sort of applying the concepts that we chatted about in our first hour. Really do encourage you all to jump in and add your perspectives. I know we're talking about data, but really selecting indicators and thinking about, you know, different aspects of a problem or an information need really is more of an art than a science. I really don't think there'd be any wrong answer. So please feel free to jump in. So if we go to the next slide, so the government has identified several priority areas related to the various programs the government is responsible for. So employment, health, education, language, and culture. So for our discussion now in the case of this case study, the group is responsible for taking a closer look at health, and specifically child and youth health in the community. So if we go to the next slide. And so the group has been asked to monitor and measure progress towards improved health and well-being of children and youth in the community. Slide. So obviously a very big task and undertaking. This is where they've decided to use that life cycle approach. So it could be valuable because it gives them a place to start. So the group decides that the step-by-step approach they're going to use to identify the meaningful indicators to inform progress and identify successes in their community related in child to youth health. So next slide. So they're going to start by identifying the need in your community related to this topic. So the next slide. So the group sets out to answer the following question. So what are our government and community priorities related to child and youth health? Who should we talk to? What are the different information needs of different individuals and organizations in our community? Based on these discussions, they think about what areas of measurement will be most important to meet the information needs to the groups that they've chatted with. And they also consider what information on this topic areas already exists that could potentially be leveraged. So if we go to the next slide. So if we can all just pull ourselves into the shoes of the folks in the case study and thinking about engaging with different individuals or groups within our communities. So who might these individuals or groups be that we reach out to get more information related to child and youth health? Or also, what are some of the other questions that you might think of that you would ask yourself on this topic in step one of the life cycle? Feel free to use the chat. Raise your hand if you prefer to chat. We can unmute you.
I think grandparents would be big, right? Grandparents know how well the kids are doing. And I think they have an ability to think about wellness through time of children and youth. So I would say, like, when I think about who's going to have an opinion on child and youth health in my community, I think about grandmothers, especially. Teachers is in the chat. Yeah, for sure. Teachers will know. Early childhood educators. Yep, child and youth workers, health staff, childcare providers, daycare workers, exactly. What about the kids themselves? How well is their health and well-being? How do they know what their needs are? I think that would be interesting. It would get you into different methods also of dialogue, probably talking with kids about what's most important to their health and well-being. What are their needs?
I see a question there. How do you decide what questions to ask? And that's a good question. I think this is sort of one of those things that often snowballs. If you start with maybe perhaps the most obvious group of people that you're going to reach out to, the next set of people might build on that. But there's also great benefit of bringing all the different perspectives to one table, and questions might spur off of each other and sort of everybody feeding off of one another.
Mm-hmm. I think often keeping the questions as simple as possible gets you the richest results, because you're letting people go with what first comes to their mind. And indicator development will get really detailed and like super detailed later in the process. So like in my mind, when I think about step one, like that's kind of your biggest space to have broader conversation. So just, how would we know that our children and youth are healthy and well? What are the needs that our children and youth have?
Yeah.
What would be the single most one thing that could happen that would improve your health and well-being? Like those are just off the top of my head. I don't know if that's like scientific, but those are some of the things that I would be curious about.
Yeah. And not starting with any expectations either, right? So that you're not limiting people's responses too.
Right. Yeah.
Yeah. Okay, great. So we can go to the next slide. So continuing, we're in the minds of the folks in the case study. So based on the information that was gathered, the next step is to start to think about relevant and meaningful indicators that might meet the information needs of different audiences. And I say indicator, but those first thoughts that you might have are probably not exactly indicators. You're probably thinking about concepts you want to measure. That's really what's coming out of that first step. And then that indicator sort of development or selection comes through. So it's usually not that clean cut. So next slide. So following the information gathering stage, pulling all that information together, the group notices that, there's one consistent theme that has been the importance of physical activity among the youth in the community. So the group decides to start there. Next slide. And so the group reviews relevant sources of data to see what indicators exist or have already been used. So they identify the measure that you see here in the orange. So the percentage of children and youth reporting that they meet the recommended level of physical activity guidelines. And it's a self-reported measure, so really rich in information because it's coming directly from the youth themselves. And they know that it's been used by others, providing really meaningful information. So others have had success in using this indicator. So if we go to the next slide. So looping back to the discussion that we had earlier on about what makes a good indicator, a good next step for this group is to sort of apply that criteria to make sure that that indicator that they've identified is going to be a good one and is going to give them the information that they want. So quickly going through this, it's relevant. Yes, the group has confirmed that it aligns with what they're hearing from the communities and the individuals that they've reached out to. It's measurable. The group knows that the indicator is pulled from a youth survey that has been used elsewhere, and it provides reliable and specific enough information and from a validated tool. It's actionable, so provides valuable information that will inform the work, and they agree that it would be appropriate for their government, and they feel like they could do something with that information. And then just looping back to that specific piece, so for them, the group agrees that this indicator makes sense for us, but after having all those conversations, they also recognize that that's probably not the right indicator for others that are interested in more information and also interested in improving and continuing the success of youth and child health and wellness. So keeping with that, we come back, if we go to the next slide, that idea of that alignment. And they come back to this idea, okay, we have this indicator. This is the indicator that we want to measure, but what are some pieces of information that might be relevant to the community or frontline programs that we might also want to consider? So I'll open this up again for chat. Don't feel like you have to throw in an indicator here, just thinking about types of information that others, and please feel free to also go beyond community and frontlines programs, might be interested in that would be tied to that overall goal of improved child and youth health, and also connected in some way to that self-reported physical activity that the government is going to monitor.
Yeah, if I was like an elected person or maybe frontline, I'd probably be like, I'd really want to know if the kids are reporting barriers to physical activity, right? Like what gets in their way of being able to, because, maybe there's no playground or soccer field or, safe place for them, like whatever the case may be. So I think that might be something that would be useful for them to also know.
Yeah. And something that they could potentially do something about. Yeah.
That's right. I think like, how are they? Oh yeah, there's some good stuff in the chat. Access to sports equipment, right? Like, do they have, are they equipped? Do they have stuff that they could actually, like kids don't like to just run on the spot. They need something to do. So what would be the barriers in place? What do they need in order to meet the physical activity guidelines, improve their health? Cultural activities might be another one, right? Like maybe not just physical activity guidelines, but what kind of physical activity are they doing?
Yeah.
And is there a tie to kind of culture there? Yeah.
Access, coaches,
Yeah.
transportation. That's a great one. Again, to the barriers piece.
Yeah.
If you skip forward, Allison, we popped in a few that we thought of. So, what program, having the community even aware of what programs are available. And then we went a little bit specific on the frontline programs too, thinking about sort of on the provider side. Great. Okay, so we can go to the next slide, which we still have room for more discussion. So keeping with our case study, the group decides, the physical activity is the indicator that we want to use. But thinking back to our discussion on frameworks, they're also really thoughtful of that big picture view. There's a lot of other things going on. So thinking back to the framework, also want to know what other indicators should they track at that government level to give them that more complete picture view. And to sort of keep in mind all sort of the multiple elements at play that may be factors in sort of overall youth and child health. So we've pulled out some of those, so emotional, physical, spiritual, mental, environmental, social, economic, culture. And I think actually from that last slide, discussion sort of picked up on some of these. But if you can think about other concepts or indicators that might be of interest at that government level to give them a more fulsome picture of youth health. You can continue to add those to the chat too. And Harmony, if you have any thoughts.
Yeah, I think like I'd be curious, or at least maybe community or parents would be interested in things like, do kids report that they have someone to talk to? Do they feel in balance? Do they feel connected to culture? Yeah.
Okay, so if we go to the next slide, you can see, so they decided that self-report excellent mental and emotional well-being will be important to capture along with their physical activity and food security. So three indicators used in this case study. It might be more, depending on your situation. This might be a simplified view, with the point being that it's never just one indicator, and a framework can be valuable to help you think about all the different elements that you might want to consider. And so if we go on to the next slide, we're moving on now to step 3 of the indicator life cycle approach. So they've selected and identified their indicators, skipping little bit, they've now collected their data and they have their indicator results. Now what? How do they make sense of their indicator results? So if we go to the next slide. And I think we'll have to hit a few buttons there, but so it usually begins with a lot of data. So it's often easier to first look at the results of an individual indicator first, and then start to pile on that bigger picture. When you're first looking at indicator results, do encourage you to really ask some really general questions. So what is the volume of the data? How many individuals are actually reflected in this? Is it 10 people or is it 500, right? Because that could really impact the type of questions you might have or conclusions you might draw. Over what time period does this reflect? Is there anything that I'm seeing that's just totally unexpected that maybe I should dig into first that might reflect, data quality or something like that? So really starting with those general questions makes sense. So the group decides, looking at all of the indicator results that they see, the group decides to start with an indicator where they're seeing the most variation. And so variation, I always say it's a flag for opportunity or an opportunity for improvement, but also an opportunity to shine light on success. So look for variation. It's often a good place to start. So if we could go to the next slide. These are all the results that they looked at. So they decide to first start on self-reported health and well-being indicator, as they quickly see that there is variation. So two ways of looking at the results first. So first they look at relative performance. So how are different groups within my community performing, and how may I be comparing to others? So first they start by comparing results for males and females in their community. On this slide, we also have a comparison group. And in this case, we've compared to the national rate. Again, this is where context and uniqueness of community is really important and comes into play. Comparison to the national average may not make sense in some cases based on your government and community. It might make sense for one indicator, but another indicator totally doesn't make sense. So really thinking about the value of making comparison. It might make sense just to compare different groups within your own community. So breaking it up by male, female, or different age groups. So in exploring the indicator results, they noticed that the rate of self-reported excellent mental and emotional well-being is quite a bit lower for females in the community compared to the other comparison groups. So from here, they decide, let's explore the results over time. So if we go to the next slide. So they look at the same indicator rate over a 3-year period to see, are the differences that I just saw, are they new differences or have they always existed? So telling a really important and sort of gathering more information. So I don't know if anyone wants to jump in and add their thoughts on what they're seeing in the slides here.
Well, the gap's getting bigger. Like that would be very troubling if I was responsible for this indicator, or if I was an elected official. I would say, why is everyone else, the males in my community, Canadian males and Canadian females, all trending a certain way, but the women are staying kind of roughly at the same level through time?
Mm-hmm. Yeah. So yeah, certainly looking at more data gives that bigger picture. It's not a new, it's not a new result concern, and it's also becoming more of a concern with that growing gap.
And it's probably something we need to do something about if it's kind of staying the same for, like the gap is widening, but also the women's rate generally just isn't increasing. And it's below where it needs to be. Yeah.
So from here, based on Harmony's beautiful summary there, this is an important result and we need to explore this further. So this is where they might bring in the other indicators that they've identified, and let's see if there's similar patterns or something else that's in the other indicators that might add to this story that's to develop. So if we go to the next slide, so looking at the other indicators, so that physical activity indicator that was selected, they're seeing similar patterns for females, again, where the males are much higher and reporting how much physical activity they do compared to the females. So thinking about our discussions earlier on today, where indicators can help pinpoint and help define priorities. In this case, the group decides that based on the results that we're seeing, it is worth further exploring potential factors associated with why the results are the way they are. And I like some of the language that we're seeing in the chat box, and from you, Harmony, it's really about what are those potential barriers that might be at play here. So if we go to the next slide, bringing back very consistent with our visuals, all the people that were engaged in that step one that have interest in this topic area. These are all that this group in the case study thinks about sharing the results with and opening up a conversation about. And then going back to those elements of the framework, what are some other factors that we should dig into further with the indicator results? So going on to the next slide. And I think there's one more there, Allison. So within the data itself, you might be able to look at things like age and location. So is that trend that we're seeing with the female for all females of all age groups, of all locations? Again, continuing to build your story, but then thinking about the framework, some of the comments that were already put into the chat, other things that might be in play that are worth further investigating. So social factors, cultural factors, and spiritual factors. And you'll see here that a lot of those elements are those self-reported elements. So getting information from the children and youth themselves, but then also those other family members and some of the other groups that you've mentioned. Okay, and then we're moving on to step 4 after they've lots of investigating to understand their results. So the final step of the indicator's life cycle, using and sharing those indicator results. And certainly all that investigating that's done in step 3 to build upon the results that you're seeing would be part of that sharing process. And depending on the people that you're sharing it with, will depend on how the level of information that is shared. So next slide, we've just created a little example of things to think about when sharing your results. So who is your audience? That's likely information that you probably figured out in step 1 as part of that engagement. In this example, we've identified the community as who we want to these results with. So what is the key message for this audience group? So the message that we've suggested is progress your government is making towards child and youth health, and potentially it's talking about new programs available for supporting young women in the community. What materials will you share? So typically, for a community, they don't need to see a graphical representation of the data. Perhaps think about visuals or types of information that might resonate and are easily digestible, and they get the key message and they don't have to read a 2-page summary of the result. But also thinking about privacy and security. Even within your organization, you want to be mindful of, again, things like the number of people that this refers to. You never want there to be a case where an individual, or in some cases, even an organization, could be identified. Different groups have different cutoffs. We always say sort of 5, 10, 30, depending on the type of data, are things to consider. How and when you will disseminate the information. A lot of indicator results don't change very quickly. So when you're talking about community, you might say, we're going to share these high-level results yearly. If it's somebody, one of your partners in the community that you are working with closely to improve on these indicators, you might be sharing information monthly or every 6 months so that you're staying connected and closely monitoring your success or improvements that you've put in place. and thinking about how information will be shared, sort of what mediums, so community meetings, annual general meetings, newsletters, and obviously social media is a big thing for all of us right now. Harmony, did you want to add anything to that?
Yeah, like what I've found is that once you've kind of identified once you have your data against your indicator in a consumable way, the first thing I always keep in my mind is like, how do I share this first with the people that it's about? So like, I always just feel that as a principal, people who the data is regarding should have the first opportunity to see it and consider it. And they can often give you advice on how to best share it. So in this case, like what the data was showing us was two things. One is like, we have a lot to celebrate in terms of the fact that the males in our community, the young men, are certainly increasing through time their physical activity levels, and that's a great thing. But what we're also seeing is that girls are not provided, for some reason, the same opportunity, and there could be a number of reasons why. Maybe there's different ways in which they're responding to the question about physical activity even, right? Maybe they're not considering all the things that they're doing every day as like physical activity because of how we tend to think about what that means and went for a run or whatever. Like that could be one reason, or it could be that they're like, we have unique barriers, right? We don't want to play field hockey or whatever, and that's the only thing available to us. We want to do this other thing, but there's no infrastructure for us. So like in that case, I would suggest, if it was me and I had that data, I'd be like, well, let me get a focus group of girls together. Let me share that data with them. Let's have a conversation about what we're seeing in the data and what they would say is the reason why, and what they're recommending in terms of solutions in that space, but also how best to share that information with the community in a good way that helps us continue to make progress. And so they might be able to give you the best ideas about how to do that. Often that data like that, once we're into this bit more of a cycle of producing data, is like an annual report or an annual general meeting would be, kind of where you would share that primarily. And the community would then use that to support their accountability discussions with their elected government representatives. So just a few thoughts from me on kind of how I go about working that once I have a piece of data in my hands.
Yeah, no, that's really great. And I really like what you're touching on there too, about, especially when we're talking about sort of that self-reported survey type data, it really should be about amplifying the voices of the people who completed the survey. And certainly engaging with that group will make messaging to other people easier. Mm-hmm. So we're talking a lot about, quantifying responses, but that idea of, you have a number, but if you compare that number with like somebody's actual story or, additional comments, or like, what does this result actually mean, is incredibly valuable and gives more information on how to, make improvements, or like you said, really highlight the successes that you are seeing, like share, the positive and the success. So that's really great. Okay, so we can go on to the next slide. So one of the topics that we wanted to touch today on is targets. Targets are another great tool that come along with using high quality indicators. And high quality indicators allow you to set meaningful and appropriate targets. So targets are also useful for communicating, as they allow you to sort of communicate expectations and also communicate clearly the success. And it can also be, targets are helpful for being a motivating tool too. So for driving improvements in areas where you're really hoping to see it. In order to be a useful tool, targets should be achievable and maintainable. So when setting targets, it's important to think about what it will take and perhaps what trade-offs will have to happen in order to maintain that target rate, not just to achieve it. Ideally, targets are data-driven, using reliable data, and using data will help make them achievable and maintainable. So using data sort of from past experience or from the experiences of others or different groups in the community. So if we can go to the next slide. So getting back to our case study examples and sort of looking at the two indicators here again, where we saw those gaps in the self-reported mental and emotional health and the physical activity, you can actually see that the trend over time is small. So even though we're trending upward, the difference is quite small. So that's an important factor when you're thinking about your targets and what would be a reasonable target. So, you know, it might not be reasonable to say that we want to see a 20% jump among females. And I think that goes to what Harmony was saying about getting to the root of the problem. Depending on what the barriers are, it might be a really easy fix. It might be a misinterpretation of the question. It might be adding a resource that's readily available and just making people aware of it. Or it could be something much deeper that's going to take longer. So taking that into account as well when you're thinking about the targets is really important. So if you look specifically at the females on the right graph, if you just want to take a data-driven approach, you know, from 2018 to 2020, they went up from about 25 to 29. So maybe it's a 4% increase over 1 year instead of every 2 years. Oftentimes, you'll probably see that many targets are often used or identified using a comparator, such as a national average or provincial average. But with target setting, it's particularly important to take that context in mind. There are many, many cases where using the national average as your target just does not make sense for many different contexts. And then again, going back to, what Harmony was highlighting about the fact that males are doing really well. So maybe the target is about closing that gap between males and females while maintaining the success that we're seeing with the males. So whatever target you set, you don't want it to take it away from another group. So perhaps your target is maintain that high rate among males while closing that gap between males and females. Next slide, please. So the final thing that I wanted to touch on is that sort of last phase of step 4, which is really about evaluating your indicators. Most likely the indicators that you select now won't be the indicators that you have forever. Again, it goes back to alignment. Those indicators have to stay in alignment with your priorities. And as we know, priorities change. So things to think about when, thinking, does that indicator still give me the information that I need? So is there still variation? Are we seeing changes? Are we seeing improvements? Have we reached the targets that we've set, and have we maintained that target level? Is the information still relevant to us? So is it still aligned with our priorities? Have all of those other people that are tracking similar indicators related to that goal, is there still alignment at that level too? Indicators, I often get asked the question, well, how often should you review indicators? If you haven't looked at an indicator in 3 to 5 years, it's probably time. But again, it's so context specific too. So at whatever rate, try to look at your indicators frequently and sort of think about those questions. Okay, and so we're on the last slide before the conclusion. Are there any questions about anything we covered in the case study, or any other sort of reflections or perspectives or experiences similar that you'd want to share?
What I'm seeing in the chat is that folks found the example useful, and that's almost in some ways the hardest part of when you're talking about indicators. Like, it really matters. The local context you're in is what drives it. So for folks like me and Doreen, we're trying to be like, how do we deliver kind of general content that's like a huge amount of content that could represent years of work, or could be a little pilot that you might do for a number of months. Like you got a big scam. And I think what's really important is to take from this what's relevant to your particular context. You will know what matters to your community. You'll know how much room you have within your role, how much of a priority this is for your government. But more and more people are moving towards performance measurement, and indicators are really critical to it. So, we could easily work with you on, like, what does this mean kind of in your specific program? Or we could talk about the whole government is going to develop a whole performance management framework and system, and develop indicators kind of across the entire scope of work. So I just wanted to make the point that this is also very scalable, big or small. And I'm always a start small, but keep the big picture in mind kind of person. So hopefully the example was somewhat useful, but I think, even just taking 10-15 minutes to talk through an example in your own government with one of the advisors would also be, I think, a really good use of time to make sure that we're connecting these big concepts right down to the ground. Okay. This one's a lot to process. So I'm seeing a bunch of just stuff in the chat about the examples. I'm getting some emails about it. So yeah, there's a lot to take in, but people appreciating the examples, and again, kind of look forward to digging into what matters in your local context. Oh, I see there's interesting observation about the slide with the graph showing the gap. I didn't see anywhere what the right level was, and that seemed arbitrary. I think that's like a really interesting comment related to, like, what is, number one, who do we compare ourselves to, and what the target is. So a lot of times I think what you were saying, Doreen, is like sometimes the national average is not the right comparator. And I just really believe that, right? We often compare ourselves to what is everyone else doing, but what makes us unique is that we're different. Like, we're Indigenous governments is different. Each of us is unique. So only you will know what is best for you. And a lot of those targets are arbitrary. They're set by somebody else sitting somewhere in some office doing the best they can, I'm sure, but they don't understand your local reality.
Yeah. And you know what? Identifying comparators is you could have a whole entire session on identifying the right comparator for you. I do want to reiterate a point that there might be a comparator that you identify makes sense for an indicator, and on another indicator, just depending on what's being measured, it might not make sense at all. So it's very situation and context specific, and a really challenging topic for a lot of people.
Yeah. And sometimes you only want to compare against yourself. How are we doing this year relative to last year? And sometimes that's all that matters, right? How everybody else is doing might not matter. Where certain things, if you're like, you know what, we're going to get ready for a big funding submission to something or other, we want to understand how we're doing relative to the national average so that we can advocate for whatever, X investment, or create a competitive funding proposal for a certain reason. So those are all the local factors that will matter most. I mean, sometimes maybe you just want to compare yourself to other Indigenous governments within your geographic region, right? Maybe that's the most relevant. There's lots of options, and really it's like that decision about what is your target and who are you comparing yourselves to is a really important one. And I would advise to make that decision with eyes wide open. Okay, we're getting close to the end of our time, I think.
Yeah.
So we want to take one more slide transition, Allison. So I think I kind of covered this in my rambling, but like ultimately, indicators are helpful to support us to make decisions. They're also important if we, like, you'll remember that graphic where we have the goal and then everybody has their own indicators that they're interested in. And that helps create alignment because we're all doing our part within our part of the system, but we're all moving towards the same goal. So I think this is where tying indicators into your strategic plan at multiple levels is very valuable. We talked through the life cycle of an indicator, which can be years or can be kind of short, depending on kind of what specifically we're talking about and if we're piloting or we're kind of in a more mature system. And we just talked quite a bit about benchmarking and targets. And this is like a huge topic for us to cover within this amount of time. So we know it's like a lot of information, but it is, again, the intention of these webinars is to provide this asset to you so that you have it. And you can come back to this, we'll post it, and be like, what is it they were saying about targets? You can come back and listen to that part. And we have the advisors to work with you through time as you start to try to think through some of these concepts. And what's really important is that opportunity would then be to talk about your particular specific context, which today we were just using the fictional example, and every government is different. Anything to add there, Doreen?
No, I think that's great. And I think you're right. Like, this was a lot to cover. I've done, 2 and 3 day workshops on understanding an indicator result. So if you're feeling like, whoa, what just happened? That's okay. But I'm hoping, you'll notice on the slides that a lot of things we put are questions. So if you might take away from this, like, questions to ask yourself, data lands on your desk. That's a good takeaway. Encourage you to, question data and take that big picture view, and also reiterate, so context specific, really no right or wrong answer here. I was just sort of that example to get you thinking about it. And thank you so much for having.
Great. Can we go to the next slide, Allison? So I want to thank Doreen and her team so much for coming in to work us through with this. And again, would just reiterate that I do think that if you're working with health data, that CIHI might be a good partner to have some initial conversations with. And if there's a way I can help with that, by all means, let me know.